Hello, my name is Adam Pasley, and this is my Nursing 552 Capstone presentation on improving patient safety during EMS to ED transitions of care through the implementation of MIST as a standardized handoff tool at Madison Memorial Hospital. Structured communication tools help to ensure patient information is exchanged in an accurate and complete manner during transitions of care to reduce the risk of error. In the world of emergency medicine, time is king. Communication errors can contribute to patient injury, emotional stress, and are pressured by time constraints. Variety in practices, interpersonal factors, and misunderstanding compound complicating factors. The MIST mnemonic offers a standardized way to structure patient handoffs. This project aims to determine whether using MIST improves the accuracy, completeness, and timeliness of patient handoffs during EMS to ED transitions and to reduce patient safety events. The study would utilize Likert surveys, cognitive load inventory for handoffs, and stakeholder collaboration to evaluate outcomes. I anticipate improvements in communication and patient safety. We'll evaluate the impact of MIST on communication flow and patient safety by measuring information completeness, timeliness, and accuracy using validated assessment tools and participant feedback. Ultimately, these findings can guide best practices for handoff processes, improve interprofessional collaboration, and support safer, more effective patient care during critical transitions. The transition of care between EMS and the emergency department is a critical piece in a patient's care continuum. This is the point where responsibility shifts from EMS to hospital staff, nurses, physicians, and others, and it must happen quickly and accurately, often in challenging conditions. In the fast-paced world of acute emergency care, communication can be a struggle during these transitions, frequently strained by task saturation, high mental load, and emotional stress. When information is missed or misunderstood, the risk of patient safety events and medical errors increase, leading to poor outcomes and greater liability. The proposed PICO research question has been applied for this project. In EMS personnel transferring patients to the emergency department at a level 4 trauma center, how does the implementation of a standardized handoff tool such as MIST compare to current unstructured handoff practices, affect accuracy and completeness of patient information transfer, and reduce communication-related patient safety errors over a 12-week implementation period? The focus of this project is to identify the factors that cause miscommunication during these handoffs and find ways to make the transfer of care process more efficient and reliable, ultimately improving patient outcomes. Medical error poses a serious consequence for patient safety and well-being, but also for the healthcare system as a whole. Nursing frameworks like the AACN Synergy Model, Benner's Novice to Expert Framework, and Donabedian's Quality of Care Model all emphasize the importance of providing care that is accurate, timely, and intentional. Medical errors and malpractice are estimated to cost U.S. healthcare systems between $20 and $45 billion every year. One way we can help reduce both harm and cost is by improving communication during transitions of care, particularly in high-pressure settings like EMS to ED handoffs. Research on EMS to ED patient handoffs highlight three major themes affecting patient safety: barriers, conflicts in medical practice, and inadequate information. Barriers include interruptions, miscommunication, and clinical or hierarchical constraints. Studies show that structured approaches like team-based reporting and the MIST tool improve communication and clinical efficiency, though some gaps in vital signs and treatment reports remain. Conflicts arise from differing professional priorities, with EMS focusing on rapid triage, while ED staff emphasize detailed diagnosis, leading to inconsistent information sharing. Finally, inadequate information during handoffs, such as missing patient demographics, timelines, or ABCDE assessments, contribute to delays, inappropriate care, and extend hospital stays. Overall, the literature strongly supports standardized handoff tools to improve information accuracy, reduce safety risks, and strengthen interprofessional collaboration, although further research is needed to establish best practices. This Capstone project focuses on improving patient handoffs from EMS to the emergency department at Madison Memorial Hospital in Rexburg, Idaho. This project will implement the MIST handoff tool to standardize communication and improve the accuracy and completeness of information during care transitions. Participants should include paramedics, EMTs, nurses, and ED physicians, all with at least 6 months of clinical experience who are directly involved in patients' transfers. Stakeholders include EMS agencies, ED leadership, quality assurance teams, and the Institutional Review Board would ensure consistency in training and adherence to policy. Effectiveness will be measured using Likert scale surveys to capture clinician perceptions and the cognitive load inventory for handoff, to assess mental workload during handoffs. This project will be guided by an interprofessional team including EMS personnel, nurses, ED physicians, and quality improvement staff. Collaboration among EMS agencies including Madison Fire Department, Fremont County Ambulance, and Mud Lake Ambulance will support standardizing protocols and training. This approach aims to enhance communications, reduce errors, and maintain evidence-based practices across the continuum of care. By implementing the MIST standardized handoff tool, it is anticipated that improvements in communication will occur during EMS to ED transitions at Madison Memorial Hospital. I propose that the expected patient information will be completer and more accurate, covering critical details like injury mechanisms, vital signs, and pre-hospital treatments. I anticipate staff surveys reflecting increased confidence and better interprofessional trust, with fewer perceived communication barriers. I expect qualitative feedback may show greater satisfaction and clearer role expectations for all members of the transition of care. Additionally, cognitive load for both EMS and ED clinicians is expected to decrease, streamlining the handoff process to be more efficient and less mentally taxing. This project is anticipated to enhance collaboration between EMS agencies and the ED, standardizing transition of care practices, improve patient safety outcomes, and long-term, these changes aim to support sustained improvements in patient safety, continuity of care, and readiness for future quality improvement initiatives, while contributing to the broader evidence base for structured handoff practices, particularly in the rural health setting. Structured communication frameworks are essential for ensuring accurate and complete information during patient transitions. Transition of care frameworks help to reduce safety risks and medical errors. In EMS ED transfers, communication is often challenged by time pressure, emotional stress, and distractions, as well as inconsistent practices or even interpersonal barriers. The MIST mnemonic provides a standardized, structured approach to the transition of care process. This study would help to evaluate how implementing MIST affects the accuracy, completeness, and timeliness of communication, and whether it can reduce patient safety events. The results are expected to build on evidence-based practice, standardized handoff protocols, and strengthen interdisciplinary collaboration during critical transitions of care. Thank you for your time and your attention. These are the references that I use in this project. Thank you.